It's your program of choice, Health Affair on AIT, a platform where we focus on public health challenges, issues about women and children, with the aim of providing lasting solutions. I am your regular anchor, Ushuomowa Daniels. On our series this week on neglected tropical diseases, we are focusing on the burden of leprosy. Please stay tuned. We'll be right back after the news segment.
Customer, here are the tomatoes. What else shall I give you?
Add pepper and auntie, this your cough is getting out of hand now.
Take it easy with her now. But customer, this your cough. You should go to the hospital.
You know I can't go there with this cough at this time. They'll just say I have COVID-19.
Customer, every cough is different. It could be tuberculosis.
It's true, auntie. Check am, make you dey sure.
Because who no go?
No go, no.
Check that cough for tuberculosis.
Check am, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
The Minister of State for Health, Senator Olorunimbe Mamora, the Executive Director, Nigerian Heart Foundation, Dr. Kingsley Akinroye, and other critical stakeholders in the nation's health sector have called on Nigerians to eat healthy to stay healthy. Speaking at the National Summit on Food, Drinks and Cardiovascular Health in Nigeria, they noted that about 76 million Nigerians have hypertension, which is about 4 in every 10 persons.
The major NCDs are cardiovascular, including stroke, diabetes, cancer, and respiratory diseases. Also, we've added here the hemoglobinopathies, and lately, clearly, we have to add mental illnesses. In fact, when we add mental illnesses, that might outstrip cardiovascular disease in morbidity. In morbidity, but cardiovascular disease, of course, are highest in mortality.
We have control over our environment. We have control over what we eat, and we know that many of these non-communicable diseases are related to what we do, what we eat, and what we drink, and that is why this program is absolutely very important. We want to talk about the food and drink and the effect on the cardiovascular health, and and I'm happy that we have just like I said, that we have many stakeholders here, including Nollywood staff, those who can drive the point home.
Through this summit, we want to focus and review the current data on national in Nigeria and global trends of the impact of food and drinks on cardiovascular health. We need to identify what WHO refers at the UN level as the best buys. Identify intervention measures which can be instituted and domesticated in Nigeria. We need to ascertain the roles of different stakeholders that are here, both that are also participating virtually and those that are also working in the field. How are they going to come together? How are they going to promote and collaborate? And lastly, to provide solutions to curb the scourge of the adverse effect of the cardiovascular health of Nigerians in such a way that our life expectancy will be able to cross the border of 70.
Aim to play advocacy role to the manufacturers on what is healthy, and also to guide the consuming populace about what is right for them. And this has achieved some success, although limited in a way. We have also had food fairs, and I remember several food fairs where we have people to demonstrate what is good and what is not so good. The dangers of excessive salt and sugar and trans fat has always been highlighted, through the executive director.
The event, organized by the Nigerian Heart Foundation, aims to create the necessary awareness amongst Nigerian consumers and manufacturers of food and beverages on how to prevent heart diseases. Poor oral health affects nearly 3.5 billion people worldwide, with far-reaching consequences, according to figures presented by the President of Nigerian Dental Association, Dr. Kolawole Obagbemiro. More worrisome is the fact that many people do not realize how an unhealthy mouth can have a severe impact on their lives, causing significant pain and suffering. With the 2022 World Oral Health Day theme, Be Proud of Your Mouth, Dr. Kolawole Obagbemiro and his colleagues are calling on Nigerians to adopt good oral health habits that can improve their general well-being.
We are really telling our members of the public is to visit the dentist. They shouldn't wait till they have problems before they go to the dental clinic, at least twice in a year, every six months, so that whatever issues are there, it will be detected early and then it will be addressed before it becomes an issue. The theme for the year is Be Proud of Your Mouth. You can only be proud of your mouth when you are free from pain or from any oral disease, and then you are confident about your mouth. You can smile, you can speak in public. That's the only way you can be proud. So you are meant to see your dentist every 6 months, because dental diseases, they progress very slowly. So patients are encouraged, or citizens are encouraged to seek dental assessment periodically, at least 2 times every year. You're supposed to be doing scaling and polishing. That is professional cleaning of your mouth in the dental clinic. It is not everything in your mouth that your toothbrush can remove. So you need the professionals to clean your teeth for you from time to time. Again, we also emphasize diet. We tell our patients to ensure that they eat right. Eat fiber-rich diets, fruits and vegetables, we emphasize. Then avoid sugary or snacky foods like cakes and or pastries and the likes. These ketogenic diets are what really give rise to tooth decay, because by the time the bacteria or the microorganism in your mouth feeds on them and then releases their waste into your mouth, you drop the pH of the mouth. And once that pH falls below a certain level, which we call the critical level, the hard tooth tissue will dissolve and then cavity will form.
Very particular about giving NDA all of the support to work towards eradicating and reducing oral care diseases in Nigeria. Pepsodent as a brand has taken it upon, we're taking upon ourselves to ensure that we nip the problem in the bud from a very early age. So we take it upon ourselves to go into primary schools and secondary schools all over Nigeria, educating people on the importance of brushing day and night, and also using, a fluoride-containing toothpaste like Pepsodent. So in the past few years, we've been able to educate over 5 million children.
The dentists are also worried about the practice of Nigerians visiting beauty salons for teeth whitening, which has serious health implications.
Most of these spas and salons, they don't have the professional training. They are looking at the external. They are looking at the cosmetic. We look at the patient as a whole patient. That's number one. Number two, there's statutory requirements for the things that are used for the whitening. I mean, there's a lamp that is used, then the bleaching agent as well. Most of these spas don't follow those statutory requirements, and it creates problems that end up back on the dentist's chair. So most of those patients end up with high level of sensitivity, high level of erosion and other issues, and end up coming back to the dentist to treat those issues.
The event also provided an opportunity to deliberate on the challenge of brain drain in this sector.
There is need to develop sustainable strategies for national preventive and therapeutic oral health services to cope with the magnitude of oral health challenges in Nigeria. The oral health workforce is also affected by brain drain, as we encourage the government to come up with strategies on retaining these highly skilled professionals.
90% of my colleagues that we graduated with are out of this country. I'm not exaggerating. And same goes to almost everybody that is on this side of the table. I'm telling you, I'm not exaggerating. Go out there and find out from any of, anyone around in the health sector. And that is why you keep seeing incessant strikes and agitations in the health sector, because the economy is harsh, and by virtue of our training, we spend many years in training. And you can imagine, after going through the rigorous training of medical education, you cannot afford the basic necessities of life. That is a big problem.
World Oral Health Day is celebrated on the 20th of March annually to showcase the benefit of a healthy mouth through good oral health hygiene. The pre-conference briefing, which is one of the week-long activities lined up to mark the 2022 World Oral Health Day, coincided with the birthday of the national president.
May the good Lord bless you. May the good Lord bless you, President. May the good Lord bless you. Hip, 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 hooray!
The situation we have in Nigeria right now, according to a study that was done by Carey et al. 2015, and their population-based study where they analyzed the type of glaucoma and the prevalence of glaucoma in Nigeria, they found out some key interesting factor that we have a high prevalence of glaucoma in Nigeria, and is largely primary open-angle glaucoma. That's the type that is highly prevalent. They also discovered that most people who are affected by glaucoma in Nigeria end up being blind. They also discovered that one of the causes of glaucoma, secondary glaucoma, is the consequences of cataract surgery. That's post-cataract surgery factor that caused the glaucoma. They also recommended that public health enlightenment could help in reducing the morbidity in glaucoma that is prevalent in Nigeria.
Glaucoma is an eye disease that causes damage to the optic nerve, which serves as a channel for visual signals from the eyes to the brain. Often referred to as a thief of sight due to its asymptomatic nature, there are several Nigerians who are said to be at risk of this disease.
Every vision loss to glaucoma cannot be reversed. That is one reason why we say have your eye checked. That means that once you have your eye, the optic nerve head destroyed with glaucoma, you cannot reverse any vision that has been lost to it. So you can see that World Glaucoma Week is a very serious, impactful program. So avail yourself this opportunity and this rare opportunity to have your eye checked for glaucoma so that we can together stop this silent thief of sight and to be able to see the world that is bright, because you can only see the world better with your eyes. Very good.
People should pay attention to their eye health because we take it for granted. We wake up every day, we see, we don't know that something may be wrong with the eye specifically. And so people who have family history of glaucoma or who have little issues with their eyes should see the ophthalmologist so that they can measure the pressure in their eye, because glaucoma has to do with the level of the pressure in the eye, and if the pressure is so high, almost like hypertension. If the pressure is so high, hypertension can cause stroke. So if the pressure in the eye is so high, it leads to glaucoma.
World Glaucoma Week is marked from the 6th to 12th of March every year to put the spotlight on glaucoma as a leading cause of irreversible blindness. The theme of the 2022 Glaucoma Week is "The World is Bright, Save Your Sight."
The Lagos state government has warned citizens to avoid patronizing unqualified eye healthcare personnel and quacks while seeking eye healthcare services. The permanent secretary, Olusegun Ogboye, during an awareness walk organized by the Ministry of Health to commemorate this year's World Glaucoma Week, explained that patronage of unqualified eye health professionals is inimical to the efforts made by the government and relevant stakeholders to reduce the prevalence of avoidable blinding eye conditions. He advocated the need for regular eye checks to prevent irreversible blindness that may be caused by glaucoma and other blinding conditions. Also speaking, Fumilayo Shokumbi, consultant in the Ministry of Health, explained that blindness caused by glaucoma is irreversible and has no cure, but can be successfully managed if detected early enough. The Nigerian government is partnering with the United Nations Food and Agriculture Organization in the containment of the spread of avian influenza and other zoonotic diseases in the country. Speaking to newsmen at a workshop in Abuja, the National Coordinator, FAO's Emergency Center for Transboundary Animal Diseases, ECTAD, Ayodele Majekodumi, said the plan was to build capacity of 60 veterinarians in its in-service veterinary epidemiology training on detecting and controlling animal diseases that can affect humans. After 2 years of zero incidents of highly pathogenic avian influenza in Nigeria, the country is experiencing a resurgence of the epidemic and therefore putting measures in place for a national response that would curtail the devastation that is anticipated. As part of the existing avian influenza response plans, the Federal Ministry of Agriculture and Rural Development is working jointly with the United Nations Food and Agriculture Organization, FAO, on additional surveillance and testing in areas around the affected flocks. The team is also working on training veterinarians to contain the spread. The National Coordinator, FAO's Emergency Center for Transboundary Animal Diseases, Ayodele Majekodumi, insists that the training will enhance skills and competencies of veterinarians to manage health emergencies in animals through surveillance. The workshop was organized by the Federal Ministry of Agriculture and Rural Development Department of Veterinary and Pest Control Services in partnership with the FAO. Despite a decline in the number of COVID-19 cases recorded in Nigeria in the last few weeks, health workers are still exposed to other infectious diseases for which they need to stay protected. This informed the donation of personal protective equipment by Health Emergency Initiative and MultiChoice to some public health facilities in Lagos State a few days ago.
Today we brought hazmat coverall suits. They are mostly used for highly infectious cases. So before we brought this to this health facility and others that we went to today, including Lagos State University, LASUT, and also Nigerian Institute of Medical Research, NIMA, and now we are here, Federal Medical Center, Butemeta. We engage those hospitals to ascertain that they need this PPE or medical consumable, and they confirmed it. So that's why we are here today. And this is not the last lap. So we will be reaching 15 other health institutions in Lagos who will need this in the course of attending to patients. It's one of the less talked about but highly unorganized area in Nigeria. So Nigeria does not have a pre-hospital policy. Nigeria does not have a system that protects those who assist accident victims. There's also very, very poor coordination between those, the A&E, that's accident and emergency ward, and the emergency agencies, the likes of LASAMBOS, the likes of FRSC. And the concern, the pain is that accident victims are picked sometimes from the road. They would get to the hospital. Some hospitals will say no bed space, no treatment, or no deposit, no treatment. Why? Because there is no initial deposit that anybody has made. Of course, somebody who is critically injured, who is an accident victim, you can't be attending, nobody will be listening to you. Even if you have 1 billion naira, you won't even know what is happening around you. So, but there's a proactive measure we have taken as an organization. Back in 2017, Health Emergency Initiative signed a MOU with this hospital, Federal Medical Center, Butemeta, National Orthopedic Ibobi, Federal Road Safety Commission, and then Lagos State Ministry of Health also keyed into that scheme to ensure that critically injured accident victims taken to the hospitals are given 24-hour lifeline or stabilization before their relatives come. This way, we have seen over 80% survival rate among those who are taken to the hospital. So that is where collaboration is key. So there are problems, there are issues, but collaboration and more commitment from private sector, putting resources there, because accident does not respect you, whether you're poor or you're rich. So we have taken this measure to ensure that more chances of survival of accident victims will be higher for Nigerians, for Lagosians particularly.
Though COVID has subsided, and we are grateful for that, because life can really be lived normally now. But we decided that we still had these things, and it was important to give it to the facilities that need it. So that's why we are still distributing it right now. So we have 5,000. So in addition to the 10,000 that we distributed from 2020 to 2021, that's 15,000.
More organizations should do things like this, especially for public facilities. In public facilities that are government subvented, there is a limitation to what can be done. So we actually rely on organizations to come in and assist us in what we do. And this is exactly what is happening today. So it's a day of excitement for us. We are grateful to Pascal, we are grateful to MultiChoice Limited for this.
Organized sector of the private sector coming to partner with us in effective healthcare delivery system. So it's always very awesome, and we are very happy, in this partnership. The donation today, we are located at Ebutemeta, here in Lagos, where most of the patients are indigent patients, So these items donated will go a long way to assist them, in terms of the consumables that they will need in their care.
The event provided an opportunity for the Executive Director, Health Emergency Initiative, Pascal Achunini, to call for a pre-hospital policy that prevents people who assist accident victims.
It's one of the less talked about but highly unorganized area in Nigeria. So Nigeria does not have a pre-hospital policy. Nigeria does not have a system that protects those who assist accident victims. There's also very, very poor coordination between those, the A&E, that's accident and emergency ward, and the emergency agencies, the likes of Lasambos, the likes of FRSC. And the concern, the pain is that accident victims are picked sometimes from the road. They would get to the hospital. Some hospitals will say no bed space, no treatment, or no deposit, no treatment. Why? Because there is no initial deposit that anybody has made. Of course, somebody who is critically injured, who is an accident victim, you can't be attending, nobody will be listening to you. Even if you have 1 billion naira, you won't even know what is happening around you. So, but there's a proactive measure we have taken as an organization. Back in 2017, Health Emergency Initiative signed a MOU with this hospital, Federal Medical Center, Ebutemeta, National Orthopedic Ibobi, Federal Road Safety Commission, and then Lagos State Ministry of Health also keyed into that scheme to ensure that critically injured accident victims taken to the hospitals are given 24-hour lifeline or stabilization before their relatives come. This way, we have seen over 80% survival rate among those who are taken to the hospital. So that is where collaboration is key. So there are problems, there are issues, but collaboration and more commitment from private sector, putting resources there, because accident does not respect you, whether you're poor or you're rich. So we have taken this measure to ensure that more chances of survival of accident victims will be higher for Nigerians, for Lagosians particularly.
Pascal Achunini noted that poor coordination between the emergency rescue agencies and the no deposit, no treatment system has continued to limit the chances of survival to many accident victims. Health Emergency Initiative is an organization that supports accident victims, indigent patients, especially those who are unable to pay their hospital bills.
What did I have? I didn't even have all the money in the world. I had just my gratuity my savings, and I said to myself, my son is turning 5. I can't afford a big party. So I put on my thinking cap and I decided to be creative with the funds that I had. What did I do? I threw a class party. Although it's small, but I made it excellent. And I ensured that I was very intentional about the things that I put into this event. I hired a mascot, I hired a photographer, and I ensured that I packaged all the goodie bags with my business flyer in it. My son is born in January, so you can say that is the best time to advertise. So when I got permission from the school to be able to do a class party, and I asked Nino, how would you feel if Barney brings your cake to class? He was so excited. And he said, I'm going to be happy, Mommy. So I took permission from the school to bring Barney to class. I am sharing this testimony for any startup who is here right now, who doesn't even know where to start, or you're still waiting for people to give you a seat in one place or hire you for your service. You need to go out and be creative about the service you have rendered. You need to know, start with all you have so that God can put all He has on it. If you don't start with what you have, how do you tell another person to believe in you? Have you hired yourself? Have you done that service to yourself? How about the people around you? Have you served them? Have you sold this product to them? So I decided to do it for my son, and he was so excited. All his classmates were excited. The whole school, you know how it is, Barney, a 5-year-old boy. Everybody was excited. He became a superstar instantly. So they got home and told their parents, we want Nino's kind of party. Nino was born in January, like I said. So by February, I booked class parties, March, April, May, June, July, August. I was flourishing in business, just doing class party that God creatively dropped in my heart because I didn't have all the huge money to have a big party. Sometimes those situations around you is to help you dig into your creativity and pull out all that God has already destined for you to do. It's already in you, but sometimes it's hardship that needs to bring it out. So celebrate your failure, celebrate the hardship, because it's your roadmap to success. That's exactly what it is.
Having resigned from work as a young banker, Sumbo Adeoye started her event planning business from a very humble beginning. In 2013, she got the call to inspire women with the Change Conference that has become a success story today.
Maiden edition. It was Start Inspiring Change. And then I started to think, what are we going to name the second one? What are we going to name the third one? That's if we're going to have. But I choose with faith and courage to do it afraid. I don't know if you need that encouragement this morning. There is something God has called you to do. This is the time you need to do it because you trust the one that has called you to do it. Not because you are the most qualified, not because you are the most perfect, because you have all the resources, but because you have courage and then you have faith.
Like Pastor Mrs. Sumbo Adeoye, many women can climb the ladder of success if they can take that bold step with faith, which is the thrust of the Inspiring Change Conference.
In the kind of period that we are in our country and with the changes that are happening, whether it is in the political life or whether it's even in our everyday lives, sometimes discouragement will set in. And I think that more than ever before, it is very critical to, let women understand that it is still best, it's, possible to pick up yourself and run and keep running and being able to achieve purpose as God has desired.
Find and be your best self. Find, because you have to find you first and be your best self.
God has now made Inspiring Change the most inspiring women conference of the quarter, and everyone is always looking forward to it. In fact, we've had tremendous testimonies of people who have come, participants who have been fired up, and today they are doing so great in their industry, leading in this fair all over the world, and I'm grateful. Yes, the message is with faith and courage, rise up and run towards the goal that God has set for you to achieve.
Issues of better participation of women in politics for a better continent, more investment in the health of women and children also came to the fore.
Inspiring Change, that is season 9. It's been a long journey, smooth, rough, but God has been faithful. Part of the world where women are not being celebrated, are not being given the chance. That's why we're backward. Women are intelligent, they are brilliant, they have potential. Some are even more brilliant than men. So we need to explore the potential in the women folks. We can't ignore what God has. When God made woman, He said, I'm making you an help comparable to. So it's losing a whole lot of help when you ignore the women folks.
We're 50% in population, okay? And it's just sad that we have to be at a place where something that should actually come almost naturally. So for a start, we're even talking about legislating it, which we shouldn't. And then even that is being turned down. It's just sad. But I believe that they will rethink it.
The health and welfare of women and children is very important. And whether you like it or not, it is women and children that suffer most when things don't go right in the society. So we will keep talking about it. It is a challenge and keeps being a challenge after how many years, but we will not stop talking about it.
Leprosy, a chronic infectious disease that affects the skin, eyes, nose, and the neck, remains a public health concern with over 3,500 new cases recorded every year in the country, according to NCDC, with 25% of them causing irreversible deformities. We have the National Coordinator, National Tuberculosis, Leprosy and Brulee Ulcer Control, Dr. Chukwuma Anyaike, to speak with us about the burden of leprosy in Nigeria.
Oga Panel Bita, na kawo mota ta ne a tayar da duk wata komada a jikinta.
Ni da yara na za mu kera miki motar nan.
Amma wannan tarin naka, wannan mataki ka ɗauka a kansa?
Oga baya son ya je asibiti don wai kar a ce da shi yana da cutar corona.
Tari alama ce ta cututtuka da dama, har da tarin fuka. Ta hanyar yin gwaji ne kawai za a iya bambancewa.
Na fi sati biyu ina fama da tari.
Ba wani abun tsoro a ciki. Ni kaina na yi gwajin tarin a baya. Domin magance wannan tarin naka, lalle ka je a maka gwaji.
Gaskiya oga ka je a duba ka.
Domin wanda bai je ba zai sani ba.
A bincike tarin nan dan ai maganinsa.
A bincike shi fa domin mu tabbatar.
Duk wanda ke tari har sama da sati biyu zai iya zama alamu ne na tarin fuka. Gwajin cutar tarin fuka da kula da mai cutar duka kyauta ne. Ku kira layin kula da cutar tarin fuka ta ƙasa a lamba kamar haka: 334 domin samun ƙarin bayani akan inda za a yi gwajin. Wannan saƙo ne daga ma'aikatar kula da lafiya ta ƙasa da tallafin mutanen Amurka.
One passenger, big auntie. Come and enter my bus now.
Hey, conductor, this cough is serious. Abeg, you need to go to the hospital.
Hospital? Auntie, if I go hospital now with this cough, those people will just say I have COVID-19.
No, they won't. Doctors say cough symptoms are different in every condition. Some are dry, others are wet, like your own.
God bless you, auntie. I have told this my conductor. The cough has refused to go, and it could be tuberculosis.
Conductor, check am o. Make you dey sure, because who no go, no go, no.
Check that cough for tuberculosis.
Check am o, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Leprosy is a skin disease it's a bacterial infection, that comes with manifestation on the skin, cutaneous tissues. Sometimes it could get to the bones and affects the nerve endings, the skin, sometimes the limbs, the nose, and others. So it's caused by a bacterium called microbacterium leprae. So it was first discovered by a great scientist called Hansen. So that's why before it used to be called Hansen disease. Now it runs a very slow, it's a very patient, the organism is a very patient one. It runs a very long and insidious one. And so many people do not know that this is what is going on. You see someone with patches that is hypopigmented on the skin, and some people may think it's normal pityriasis vesicular or vitiligo. But one thing about it is that, pain is very important. Pain saves us from a lot of things. When you have pain, you react. But on this case, if you touch the skin, the person doesn't feel any pain. Because it affects, yes, that's number one. And sometimes because it affects the nerve endings, people may hit their legs. People that have it may hit their leg on the wall. They will know it's painful, and then the thing is eating. And that's why it affects, when it starts affecting those areas. You see some people with claw hands. So that doesn't affect the fingers and the toes. And then some people, the nose, they have this nasal bead will fall. You understand me? It can even make people to get blind and others. So the fact there is that it's a very patient one. It goes very long and serious cause. Just like tuberculosis too. Your immunity is low, your nutrition is not, optimal. You could come down with tuberculosis. Two of us could pass through, a particular area, and we had it and I had it. For tuberculosis, if your immunity is weaker, you may have tuberculosis more than before me. My body system will start fighting it. It can keep it for a while. My body system could take care of it. If it's not strong enough to take it, it can stay there. That's what we call latent tuberculosis, to have patient until when something comes up. And that's why it comes up when the immunity is low, maybe elderly, maybe when the person, when the person has diabetes, when it's coming down, it's not being controlled, it comes up. When it's on any immunocompromised station, it comes up. And for those that, something that has to do with your lungs, the coal miners and others that have suffered so long, by the time they start getting old, their lungs have become so weak, tuberculosis will strike. Because they may have had it in their system. So when the system becomes weak, it comes up. And Nigeria joined the global world, in achieving the elimination target in 2000. That elimination target was that you're getting less than one case in a population of 10,000 people. But 20 years after, we are seeing that the leprosy is coming back. And Nigeria has joined the 23 countries globally that have known to record at least above 2,000 cases in a year. And the worrisome aspect of it is that children are not spared. The data we have is that 9% of their proportion are children. So children coming up with leprosy means that the infection is new, it's coming back. Do you understand me? So for children to not come up with leprosy means that it's still with us and it's coming back. It's a fresh one, it's not an old one. Now the problem we have is that I think that why there's a resurgence of leprosy is because there's a shift, a global shift. When HIV came, a global shift from other interventions to HIV, malaria, and other infections. So that has taken the eye out of it, without knowing that leprosy is creeping back to the communities. So if this aware, in fact, you won't be shocked that people will ask you, do you still have leprosy in Nigeria? But the answer is yes. Last year we recorded more than 2,000 leprosy cases in Nigeria, and 9% of them were children. So having it amongst children means that it's a fresh one and is still going around. Is contagious, but it takes a long distance. You must be in constant contact with the person before you get it. That's why the protocol is that if you stay with someone we keep checking you for at least 5 years to ensure that you, and then if you have any signs, you go straight, because it runs a very long course. Early detection is very important. If you get diagnosed people early enough and place treatment, they are cured. And it will run away, people run away from getting the complications of eating the part of their body, the fingers, the toes, and others. One thing about it is that once you start eating off your fingers and your toes and all that, it cannot be, those places cannot regenerate again, because you cannot have them again. And those are the complications. And that's why most of them that have been cured, you see them with gloved hands. The only thing we can do is to support them. And most of them are not supported because of the issue of stigma and discrimination. Sometimes you see them on the highway hitting drums and waiting for those because of the stigma. Why the colony came, because we want to make sure that they are observed to take the treatment. But the fact is that after the treatment they get cured, because of the stigma, because of the discrimination, because of the social aspect of it, they can't go back to the communities. So they prefer to stay there. So if we have to end leprosy and go back to what we achieved 20 years back, we must work on our awareness creation. And that's where you come in now, your colleagues. That leprosy is back. Leprosy is curable. Leprosy can be prevented. And treatment for leprosy is also free. And it's not a cause. They're not caused by God. They're not caused by any person. And no person has the power to make you have leprosy. So, and because it runs a very long and insidious course, people get it mixed up. So early detection, and then capacity of people to know that, look, once you have a skin lesion that you have tried the normal thing, go and see a dermatologist. You're just subject to small investigation, and once it's confirmed, you start treatment. And if you start early to treat the infection, all the complications wouldn't come. But awareness creation is very important. In fact, at the moment we are working with, there's an app, that we have working with Netherlands that you can use to track, where the signs and symptoms, and you can be able to track where the people are and how to help them out.
If you are just joining us, it's Etafe on AIT. Please follow us up on the series as we take you through the burden of Bruley ulcer on our next edition of the program, which will be the last on this series. Let's take you to our nutrition segment, where we'll give you information about fruits and food items, their nutritional values, to enable you make informed choices.
Tiger nuts, also known as earth almonds, were one of the first plants cultivated in Egypt and traditionally used as both food and medicine. Tiger nuts are rich in a variety of nutrients and have been linked to several health benefits. Tiger nuts are rich in antioxidants, which are beneficial compounds that protect your body against aging and diseases like cancer and heart disease. Tiger nuts also promote digestion in various ways. Contents of tiger nuts are as follows. Calories 103 to 121 grams. Fiber 2 to 7 grams. Carbs 9 grams. Protein 1 gram. Fat 7 to 9 grams. Vitamin E 278% of daily value. Iron 13 to 40% of daily value. Phosphorus 9 to 11% of daily value. Vitamin C 2 to 8% of daily value. Magnesium 3 to 5% of daily value. Zinc 5 to 7% of daily value. Potassium 3 to 5% of daily value. And calcium 1% of daily value.
Follow me to our clinical segment for tips on healthy living.
Hepatitis is an inflammation of the liver. That means it is injured, okay, and it cannot function very well. And sometimes it can lead to cirrhosis. It hardens it, and that can also progress into cancer. Hepatitis can be caused by viruses or even taking of toxic substances. Just like they encourage people to test for HIV because they say it doesn't show on the face, you have to get tested. And if one is tested, they say that prevention is better than cure.
Your contributions on how to improve human lives, the nation's health infrastructure, and other sectors of the economy on our perception segment remains a top agenda for us on Health Affairs Desk. So you can participate by calling the numbers showing on your screen.
You're investing or you're putting your TSR in entertainment, remember road traffic victims. Remember that post-crash care and pre-hospital care for Nigerians can go a long way in saving a lot of lives.
Thanks for staying with us. Please join us same time next week for another edition of the program. Don't forget to support the program by advertising your health products and services with us. My name is Oshuo Mowa Danes. Please keep staying safe.